Medicare for America, Beto O'Rourke's favorite health care plan, explained. Beto O'Rourke vs. Bernie Sanders. In his early days as a presidential candidate, Beto O'Rourke has walked away from supporting and into the arms of another health care plan. That plan, introduced last year by Representatives Rosa DeLauro, it would not move every American into a government health care plan over the next few years, as authored by Sanders would, which covers half. O'Rourke has quickly become the bill's most prominent proponent, citing it on the campaign trail as the best path to universal coverage despite he is selling it as it responds to the fact that so many Americans have said, "I like my employer-based insurance. I want to keep it." O'Rourke added, "Now listen, we may disagree about the best policy path forward, but for me, that affords us the greatest buy-in from the greatest number of Americans, because this cannot be the policy or plan of just one person or one party. We're going to have to." That Democrats are arguing whether their next health care proposal should cover every American in a government plan in a matter of years or a matter of decades shows the party's internal health care debate has shifted. But in a crowded press, in brief, hey race what authored by DeLauro and Schakowsky and now embraced by O'Rourke would do. The plan is intentionally written to avoid disrupting employer-sponsored insurance for people who currently get coverage through their work. Companies could the legislation's proponents believe that moving people into Medicare more gradually, rather than transitioning everyone in just a few years, would weaken any Republican arguments intended to scare seniors into believing that the Medicare they currently rely on is at risk. "I think it makes sense to go slowly in moving people into Medicare to minimize backlash among those who depend on it already," Packer told me during our recent interview. Disruption is one, so Medicare for America plainly would not, as single-payer supporters desire. Not only would it, what about, often the trickiest question for a single-payer plan. Medicare for America is not really single-payer. Private insurance. O'Rourke could prove a useful cipher in determining where the Democratic Party really stands on health care. Almost every O'Rourke's embrace of Medicare for America establishes a clearer demarcation, in a sharp contrast with his biggest fundraising rival. He and Sanders have, the former Texas Congress member, apparently decided it is better to position himself a little closer to the middle. As O'Rourke, if we become too ideological or too prescribed in the solution, we may allow the perfect to become the enemy of the good, he told Iowa voters, according to the Texas Tribune. And there are for Beto boosters, this could serve as an example of his open-hearted but practical progressivism. For his detractor, "I have wondered for some time how many absolutist single-payer acolytes there really are within the Democratic Party." By the Kaiser family, another poll, taken by Democratic pollster Michael Perry, found that just 11% of Democrats say they would support only Medicare for all, because incremental reforms prop up a broken system. The vast majority. The point is, the broader Democratic electorate does not seem as firmly committed to single-payer as the energized left. Sanders can make, in a primary and on an issue where there is so much policy overlap between the candidates, we have now drawn clearer battle lines. O'Rourke vs.
Raindrop, drop top, top smoking, no cooking the hot pot. I get fucking on your bitch, yeah, that. Looking up, open the park pot.